can a single glass of a sugary drink damage your liver seriously? Let's have a look. So a recently published article in one of the most reputed international journals shows that consuming high fructose corn syrup or high sugary drinks can cause severe damage to the liver. Not only does it cause a condition called as fatty liver, it also causes something called as metabolic syndrome, that is presence of diabetes, increased cholesterol levels, and eventually leads to damage or fibrosis of the liver. Now this is a very serious cause of concern. Now what happens exactly once you consume these sugary drinks? So all these sugary processed drinks have a large amount of what we call as fructose corn syrup. So these high sugar or sugary drinks or sodas or carbonated beverages, they consist fructose. Now fructose corn syrup is metabolized or broken down directly in the liver. Once it is broken down in the liver, it gathers in the liver in the form of fat. Once this excess fat deposition happens in the liver cells, it leads to a condition called as steatohepatitis or fatty liver. And as you all might have heard now, that the longer it stays, the earlier the liver damage happens. So are diet sodas safe? Well, many people consume a lot of diet sodas thinking that they're very safe. But the problem with diet sodas of any brand is that they alter the bacteria of the gut. Now there is a connection and exchange happening between your gut as well as your liver. So whenever there is change in the bacteria of the gut, it can directly cause swelling or inflammation of the liver and lead to damage of the liver in the long run. So it's important to understand that not all diet sodas are safe. So now which are the high risk groups who have a high risk of having liver disease due to consuming these sugary drinks? People with a sedentary lifestyle, people with a family history of liver disease, high cholesterol levels, people with diabetes. However, I see often in my practice that very young patients, about 20 to 30-year-olds, come with significant fatty liver. And on inquiring, I understand that they have been consuming a lot of processed juices, sugary drinks, sodas, diet sodas in large quantities. And that could be one of the reasons why they have developed fatty liver at such a young age. So always be careful about this. So when should you get checked for fatty liver? So there are some risk factors where you can develop fatty liver. That is a sedentary lifestyle, if you have a history of diabetes, if you are obese. Apart from that, there are some other conditions in which you can develop fatty liver. Diet rich in processed foods, processed sugars, family history of liver disease. Normally, any fatty liver does not have symptoms. You may not even experience symptoms. So it is important to get a routine screen, sonography or an ultrasound of the abdomen to see whether you have fatty liver. If required, your doctor will recommend you to undergo a test called as a liver elastography or a fibroscan to assess how much damage or swelling is there in the liver. But these tests should be done under the supervision of your doctor. So if there is any suspicion of fatty liver or early fatty liver, that should be checked up by your doctor. So my final message on this topic is consumption of daily processed foods, processed sugars and sodas is harmful for your liver. Your liver does not give early signs. It's important to get your liver checked regularly. It is a very important organ which helps you in your daily routine. So take care of it before it starts asking for your help. In order to help your liver, it's important to stay active, avoid sedentary lifestyle and avoid processed foods and sugars.